Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for our fall series for coverage year 2024. Today's webinar is HealthCare.gov Redetermination and Renewal Process for 2024. I'm Ayesad Oriale. I'm the Health Projects Assistant at the Center on Budget and Policy Priorities, and I'll be moderating today's webinar. Beyond the Basics is a project of the center. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The center is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and while we do hope you learn a lot, we are not able to offer continuing education credit for our webinars at this time. Next slide. Automated captions have been enabled for this webinar. To view them, you can either click on the More option with 3 dots at the bottom of your screen, or you'll see 2 CCs icon at the bottom, and you can turn on closed captioning. All participants are muted and in listen-only mode. Though if you'd like to ask a question, you can click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will pause for Q&A during the presentation. We may not be able to answer every question asked, but we will have a record of all of your questions and we will use them as a guide for future resources and presentations. And you can also email your questions during and after the webinar to beyondthebasics@cbpp.org. A quick reminder that you won't be able to click on your screen to go to any of the links shared in the deck, but I will put a link to the full slide deck in the chat. And after today's webinar, we'll email a recording of the entire presentation along with links to the slides and other resources. And we'll post everything to the Beyond the Basics website. Next slide. Here you can see the schedule in our fall series. We will still cover the same core concepts we always do, but we've added new examples throughout the series and of course integrated updates as policies have changed. Coming up next week, we'll cover the second part of our webinar on eligibility and outreach and application issues for people who are immigrants. Then we'll wrap up the English language portion of the series with tying it all together on October 24th. Our webinar in Spanish will take place on October 26th. This webinar focuses on enrollment issues most relevant for people who are immigrants and people who live in mixed immigration status households. We are excited to be celebrating 10 years of marketplace coverage as a part of our series this year. And to celebrate, at each webinar, we'll be spotlighting veteran assisters from around the country. Next slide. Today's webinar will cover redeterminations of APTC and CSR for people who are automatically re-enrolled in 2024 coverage, re-enrollment in the same or a different plan in 2024, and an overview of the notices sent by HealthCare.gov and insurers. Today's presenter is Jenny Sullivan, Director of Health Coverage Access at CBPP. I'll turn it over to Jenny for our anniversary segment and to get us started.
Great. Thank you so much, Ayesad, and welcome everyone this afternoon. So this week, we are actually featuring 2 assisters as part of our 10th anniversary spotlight. First, we have Cynthia Nunley. Cynthia is a navigator with Enroll, Wyoming. She was nominated by her colleague, Bestie Edwards, who described Cynthia like this. Cynthia has been a beacon of hope since the beginning of the Affordable Care Act and is still going strong and saving lives 10 years later. As a navigator, Cynthia has traveled the state, spreading the message of affordable, quality health coverage. She works selflessly, tirelessly, and with great passion to find, educate, and assist consumers, and she always goes the extra mile. At one time, Cynthia was the only navigator serving the entire state of Wyoming. She's a retired teacher, plays in the Casper Municipal Band, serves on the Cover Wyoming Kickoff Team, and is an organizer and board member for the annual State Native American Education Conference. We asked Cynthia, of course, to share some words of wisdom for other enrollment assisters, and she said, As a member of the inaugural Enroll Wyoming team, I quickly learned that it was we together who made a positive difference in people's lives by demonstrating respect, instilling trust, and caring enough to stick with consumers until they have the answers they need. Cynthia, thank you so much for your service to your community. And we recently learned that your tumbler did not arrive, and we are very sorry about that and are on our way to sending a replacement. So you can eventually enjoy that. Let's see if I can get the slide to advance. There we go. Okay, so next up, our second featured assister this afternoon is Elizabeth Kostichka. Elizabeth is a broker and the owner and president of Wisconsin Insurance Services in Green Bay, Wisconsin. She's been doing this work since the marketplaces began and assists people in English and Spanish, as well as people from the Hmong and Somali communities in her area. In her own words, she shared with us that being an effective bilingual assister means a lot to me because my community can depend on me and they know I'll be here when they need me and that I will take the time to listen to their needs and concerns and advise them on their options. Being dependable year after year, people know where to find me and I am always available to them by phone, email, text, WhatsApp, and Messenger. A valuable lesson I learned is that every person's situation is different. Listen carefully and with compassion, no matter how long it takes to untangle their situation. It's very rewarding when it's finally solved. Being an advisor and broker. Thank you so much, Elizabeth, for your service in your community, and we hope that your tumbler arrived intact. Okay, so now onward with today's feature presentation. So first, I just want to center us on what the dates are for this coming year. They haven't changed in HealthCare.gov states, so we're still looking at an open enrollment period that runs from November 1st of this year through January 15th of next year. So the dates in yellow, anytime up to December 15th, if somebody re-enrolls and picks a plan for next year, then their effective date of coverage will be January 1st, 2024. On the map or on the calendar there, you'll see in the orange square, December 16th, that's the date that automatic redetermination and re-enrollment will happen so that people who haven't taken action by that date will also have a January 1st start date for the coverage that they are automatically re-enrolled into. But everybody has a chance to change plans anytime before the end of open enrollment on January 15th. And if they change plans after December 15th, then assuming they don't have a separate special enrollment period, then the coverage that they choose up until January 15th will be effective starting February 1st. Enrollment dates are not consistent from one year to the next, I will say that. And I think any of us who've been doing this a few years certainly know that they do fluctuate. So you can look up where your state, what your state's dates are here on this slide. We even had a little bit of fluctuation from last year till now. But the bottom line is know your dates and make sure that the folks you're serving understand the importance of those dates and what they mean vis-a-vis re-enrollment dates, automatic re-enrollment dates, and coverage effective dates. So now let's get more into why it's so important to encourage active re-enrollment. And this is by far the most important takeaway of everything we're going to talk about today. So first, it's important because look at where we landed last year at the end of 2023 in open enrollment. And this is not effectuated enrollment. Effectuated enrollment, that's people who actually paid the first month's premium, is a little bit lower, as it always is. But 16.4 million people, a record number, chose plans last year. Out of those, 3.7 million were brand new last year, which means they might not know anything at all about how the re-enrollment process works or understand that they have to do anything, or that if they don't do anything, what are the consequences for them? And that's what we'll talk a lot about today. But as you can see, we've got a lot of new people that we need to introduce to this re-enrollment process and help them through. We've also got a good 5 million or so people from last year, we'll see what that looks like this year, who automatically were redetermined last year, which means they didn't come back and update their information. They didn't engage with the process at re-enrollment time last year. And those are folks that may have gotten a surprise when they got their first month's premium in the new year. And hopefully they stuck with that coverage, but we will see. And the important thing really is that as many people as possible, even if they think nothing at all has changed about their circumstance and they're perfectly happy with their 2023 plan, we know there are really big implications at re-enrollment time, and that the ground can shift beneath people even if they are not aware of the changes. So we really want everyone to come back, update their information, and look at what the options are for next year. So again, why is it so important to come back and update your information? Well, you want to get an accurate eligibility determination. People in the household may be newly eligible for Medicaid or CHIP. They may be eligible for more or less premium tax credit. They may be newly eligible for cost sharing reductions. And we want to get the most precise estimate of financial help that they're eligible for next year so that they avoid having to pay back any of that credit the following year. And we also want to make sure that people get as much cost sharing assistance as they qualify for, because there is no reconciliation opportunity for cost sharing reductions. If you forego the chance to get them, that you're out of luck when it comes time to reconciliation. The most important things to update are your income. 2024 income projections might be slightly different than the information that the marketplace has about the person's income, which is going to be based on 2022 tax data. Or potentially information that somebody provided if they updated their income at some point during the 2023 plan year. But household size also changes. People's offers of employer-sponsored coverage change. People's eligibility for Medicaid and CHIP changes. So we really want to make sure to come back and update the application with all of this information, and then look at the new plans that are available for 2024. On the marketplace side of things, there are also always changes. Certainly premiums and out-of-pocket costs, plan design overall changes from one year to the next. And it's really important to underscore that even if somebody's in a benchmark, the benchmark silver plan in their area right now, that may not be the benchmark premium next year because it's the second lowest cost silver plan. And depending on the bids that came in from other plans, there might be a different plan that's the benchmark plan. And that has implications for the calculation of the premium tax credit. So we really want to make sure, again, people come back and that they understand that they can cancel a plan if they get automatically re-enrolled in a plan that they don't want, as long as they're taking action by the end of December. Okay, so from this point forward, most of what I'm going to be talking about is really focused on HealthCare.gov, as opposed to the specific processes in state-based marketplaces. But the overall principles do apply. And if you have specific questions about your state, feel free to put those in a chat and we can follow up afterwards. So annual renewal is a two-step process. It's redetermination first and then re-enrollment. So first, the marketplace redetermines someone's eligibility for financial help. That's premium tax credits, or PTCs, and cost sharing reductions, or CSRs. And in the active renewal process, this information is coming from the enrollee. This is my income for this year. This is my household size. If somebody is passively being renewed, then HealthCare.gov will update the enrollee's information based on the information they have available about the household in the federal data hub. After the eligibility redetermination takes place, then we move to re-enrollment. If the person is still eligible for a marketplace plan, then they need to re-enroll in a plan for 2024. If they're actively renewing, this looks just like the initial enrollment and plan selection process. So you can help them through that process, help them compare the various plans and the prices, and think about provider networks and plan design. With passive renewal, HealthCare.gov uses its own hierarchy to reassign the enrollee to a 2024 plan. And there are some changes coming to that process this year, which we will talk about. So now I want to get more into the weeds of how that passive renewal process works, starting with how HealthCare.gov conducts an eligibility redetermination. So first, the marketplace gets information from the IRS about the enrollee's income from the most recent year they have data available from. And in most cases, if the enrollee filed taxes earlier this year, that's going to be their 2022 income. Now from there, the system will sort people into two groups. People the marketplace can automatically redetermine with financial help, which you'll see at the top of the slide with the green line. And people the marketplace can automatically redetermine, but without financial help, and that's below in the red line. The people in the top group who are eligible for financial help can choose to do nothing, and they will be automatically redetermined eligible for APTCs and CSRs if applicable. And their level of financial help will be calculated using the updated poverty guidelines, as well as the new benchmark premium and the enrollee's most recent income information. We'll walk through an example of this in a little bit. Now, this is the part that's new for next year, or really for re-enrollment this year. People in this situation who are eligible for cost sharing reductions, but who would have been automatically re-enrolled in a bronze level plan, will be moved to the issuer's silver level plan within the same network if the silver level plan costs less than or the same as their bronze level plan would have cost. And this is to help ensure that as many people as possible get the full benefit of cost sharing reductions. And I'll talk more about this in a bit as well. Now, these people can also choose to provide updated information to the marketplace and have their financial help redetermined based on that new information. And this is in that sort of middle orange box on the slide. This can happen anytime during the open enrollment period, including after December 15th, when people have been automatically re-enrolled in another plan. People that the marketplace determines are not eligible for financial help will also be automatically re-enrolled, but without financial help. Now, this may or may not be accurate, depending on the enrollee's actual circumstances, but they will still be on the hook for the first month's premium unless they either cancel the plan or update their information. And then they can also level up to that orange box and be considered for financial help if they engage with the marketplace, provide updated information so that the marketplace can make an eligibility determination. So let's talk now a little bit more about the notices that people will get either in the mail or in their HealthCare.gov account, or both, depending on how they've set this up. So the big one is the Marketplace Open Enrollment Notice. And that's the notice that the marketplace sends to people about a month before open enrollment begins. So these are already going out to people right now. You can see the screenshot on the slide here, and you can look at sample notices from CMS at the link in the upper right corner. The Marketplace Open Enrollment Notice includes information about open enrollment dates, a description of the redetermination and re-enrollment process, and a description of how eligibility for financial help will be redetermined if they don't come back and update their information. There are different versions of this notice for different people. For example, there's one for people who will be re-enrolled without financial help, who could be on the hook for that January premium. And it warns them that this will happen and encourages them to come back and update their application before December 15th. So now I'm going to talk more about the different groups of people who will get different versions of this Marketplace Enrollment Notice. Open Enrollment Notice, excuse me. So first you have this standard group. This is likely the largest group. These are people who have granted the marketplace permission to pull tax return data, who have updated their application in the past couple of years, who are enrolled in coverage with financial help this year, and who don't fall into one of the two special groups that can't be automatically redetermined. If these people don't take action, then they're automatically re-enrolled with a newly redetermined level of financial help. Then we have people who are not eligible for redetermination of financial help. People in this group have to come back to HealthCare.gov to update their information in order to get an updated eligibility determination for financial help. Now, this could be because they didn't check the box on the application authorizing HealthCare.gov to pull their tax data to update income and household size. This could be people who have been auto-renewed in the past for the past 2 years, and there's no IRS information on their income for those years. This is called the repeat passive group. And then there's people who aren't currently getting any financial help. So clearly the marketplace can't provide any updates on whether they're qualified for financial help because they weren't getting it in the first place. So there's no information upon which to make a new determination. So people in any of these groups will be re-enrolled in their marketplace plan. So their coverage will continue, but they will not get APTCs or CSRs unless they come back and update their information. Now, in previous years, the marketplace would have reached out to people who failed to reconcile their APTCs at tax time in a previous year. This is called the failure to reconcile group. They would get a notice saying they hadn't reconciled and requesting that they attest that they've filed a return and reconciled their past year's APTCs. And it was necessary for somebody to make that attestation before they could continue to receive APTCs and CSRs in future years. Now, for several years, the marketplace hasn't been acting on this group because of the pandemic, which has caused significant processing delays, which have continued at the IRS. So people with failure to reconcile status have been allowed to be redetermined without making any attestations about whether they've reconciled. Now, this will remain the case for renewals of coverage for 2024, but there's a new requirement that CMS has put in place and that they are working to implement that will eventually be implemented once the IRS has the capacity it needs and the ability to do it. And it is that if people have failed to reconcile for 2 consecutive years, then they will be notified in their marketplace open enrollment notice that they have to demonstrate that they've complied with the requirement to reconcile in order to keep their APTCs. And people who don't comply will have their APTCs discontinued for the coming plan year. But again, they won't have their marketplace plan discontinued. And so always important that people understand that they could be on the hook for the full cost of marketplace coverage if their APTC ends, but their marketplace plan doesn't. And then just a general disclaimer that we always say around this group, the fact that failure to reconcile is not having an impact on automatic redeterminations right now does not mean that people do not have to reconcile their tax credits. That requirement remains in place. It has always been in place, and people do need to reconcile any advanced premium tax credits that they receive. So what happens if somebody is renewed and they don't continue to receive APTCs? Well, this could be a pretty hefty sticker shock. And so it's really important that people check in with their account, that they read those notices, and they understand the implications going into 2024. And if the cost of coverage is out of range for them, out of their affordability range, then they can go in and cancel that coverage before the end of the year. So by December 31st, basically. If they don't cancel their plan, then as I've said a few times now, they're on the hook for the January premium. They don't pay their premiums and that coverage goes into a grace period, but they do have to catch up on all the premiums they owe by the end of the 3rd month of coverage in order to stay enrolled. And if they don't, then the issuer can terminate their coverage back to the end of the 1st month. So back to the end of January in this example. And if this happens, they're still on the hook for the full cost of any healthcare services that they received during the 2nd and 3rd months of the grace period. And they're still liable, of course, for that full premium in January. So it's really important that people understand how this works so that they're not caught off guard. It might not be intuitive to think, oh, I didn't engage with the process, I didn't say anything, and so there's no implications, financial or otherwise, for me. And unfortunately, that is not the case. So let's now go to the very last group when it comes to the open enrollment notice. And these are people who are not eligible for auto renewal. These are people who not only are they not eligible for financial help to continue, but they can't have their plan renewed at all. This is a small group, and it's generally people with or households where at least one person is eligible for Medicare. And if one person from the group becomes eligible for Medicare Part A or is found to be enrolled in Medicare Part B, then the marketplace plan is terminated at the end of the year for everyone in the group, not just the person who's becoming eligible for Medicare. Now, the people in the coverage group who aren't becoming eligible for Medicare won't be automatically re-enrolled in marketplace coverage, but they can come back to the marketplace, update their situation. They will qualify for a special enrollment period, and they will have the opportunity to re-enroll for the new year. So now let's talk about how the APTC is redetermined in the automatic process. And this is where a lot of the math comes in. So remember that in order to determine the amount of someone's PTC, we need three pieces of information. We need the relevant poverty guidelines for the year. We need the benchmark premium for the area where they live. And we need the most recent income information available for that person, adjusted for the applicable federal poverty guidelines. And you can see a table on the right here, which is also in the FAQ, linked in the corner, that shows the applicable adjustment percentages when we're converting somebody's income from 22 or 2023 to the 2024 coverage year, which, just to get real in the weeds, remember, is based on the prior year's federal poverty guidelines. So we're adjusting things to the 2023 federal poverty guidelines, which are the ones we use to determine financial help for 2024. So for income, there are several potential sources of information that the marketplace can use, and this is the hierarchy. So first, the marketplace will use 2023 projected income if it's available. Then if there isn't 2023 income projection, maybe the person was auto-enrolled last year, then the marketplace will use 2022 tax return data from when somebody filed earlier this year. If neither of those sources is available, then the marketplace will go back to the household's 2022 projected income that they provided when they enrolled, conceivably in as early as fall 2021. So we're looking back quite a ways at this point. So let's look through an example here. This is just an example of how this works, and a reminder that the marketplace will do all of this math for you. You will not need to be cranking any of these numbers on your own, but we want you to understand how the marketplace is coming up with these numbers so that you're ready to answer questions for the folks you're serving. So in our example, this is Manuel. He is 28 years old and has a household size of 1, and we're going to assume his income is equal to 150% of poverty. And for reference, I pulled sample 2023 plans from Tulsa, Oklahoma for this example. Now let's look at how HealthCare.gov would treat Manuel's renewal if he had no income updates during the year. So at open enrollment last year, his projected income was equal to 150% of poverty. And with the enhanced PTCs that have been available for a while now, he's actually eligible for a $0 premium plan. The benchmark plan is $4,824 annually. And so that's the same, or that's equal to Manuel's total premium tax credit. Now this year, when it comes time to redetermine, HealthCare.gov will adjust his income based on the change between the 2022 and the 2023 federal poverty levels, making his redetermined 2024 income $21,869. Now, the benchmark premium at the same time has also changed. It's increased a little, but he remains eligible for a $0 premium plan, so his tax credit also increases to $5,012. Now let's look at how this would play out if Manuel did update his income at some time during the year. His 2023 projected income was equal to 150% of poverty, but he updated his income to $27,000 a few months ago because he got a new job, got a little more money. So this is equal to 200% of poverty based on the 2022 poverty guidelines. So he's responsible for a minimum contribution of 1.95% of his income, or $527 a year. We subtract $527 from the benchmark premium and get $4,297 for his adjusted premium tax credit in 2023. Now this fall, HealthCare.gov is going to adjust that $27,000 income based on the 2023 poverty guidelines. So we'll multiply it by the right factor from that blue table before, which will bring his income up to $28,966. They'll use this income amount to calculate his APTC. His required contribution is still 1.95% of income. So 1.95% of $28,966 is $565. Subtract that from the new 2024 benchmark premium, and we get his new PTC of $4,447. That only equates to about $3 more per month out of pocket from Manuel. So luckily he is in a rating area where things haven't changed too much. So he's not going to feel that change, hopefully, too much. But let's look at one more scenario with Manuel. This time, let's say he was passively renewed last year as well. So for 2022, he enrolled with a projected income of 150% of poverty. Then last year, HealthCare.gov adjusted his income for 2022 poverty thresholds. And he also filed his taxes this past spring, and his 2022 income from his filing was equal to about 181% of poverty. So it was higher than he had projected. So he might have had to pay back some of the APTC he got last year. So we don't have a projected income for Manuel for 2023. The most recent income information we have is the $23,250 from his 2022 tax return. So what will the marketplace use for his 2024 income? Will it be the income used for passive renewal last year, adjusted for the 2023 guidelines? Will it be the income from his 2022 taxes? Or will it be the income from his 2022 taxes adjusted for the 2023 FPL guidelines? Sure, you would all get this right, but the answer is C. It would be the most recent income information we have on him, which is from his 2022 tax filing, and then the marketplace is going to adjust that for the poverty levels that are applicable for next year. So in the first line here, we can see what he was paying in 2023 after passively renewing. Because he was eligible for a $0 premium, he wasn't paying anything. He enrolled in a benchmark plan, so he paid nothing. But then for 2024, the marketplace is using his 2022 income from his taxes, adjusted for the change in poverty levels between 2021 and 2023. He'll have a higher expected contribution percentage and a lower premium tax credit than before. Now, in this case, Manuel will be paying about $27 a month for the benchmark plan, assuming that that's the plan that he was auto-enrolled into, and it might not be, depends on fluctuations in which plan is the benchmark plan in his area. But keeping it as simple as we can, we'll assume he stays in that benchmark plan, and he's still going to be paying $27 a month, which is more than what he was paying before because he wasn't paying anything before. That's not a lot, but that could be a real surprise if somebody hadn't been paying anything for the past year or several years, and all of a sudden, after doing nothing, gets a bill in the mail. So we really want people to either come back or for people to understand and check their account at the very least after December 15th and make any changes that they need to make to their January coverage. So with that, I will pause. We're about halfway through and see if we have any questions. Ayasat?
Yes, thanks, Jenny. We do have a few questions for the first half of the presentation. I'll start. If people are not receiving APTC, will they be automatically re-enrolled? What if they weren't eligible for APTC in 2023, but might be for 2024?
Okay, so stacked question. Okay, so for the first part, if people aren't getting APTC, they will still be automatically re-enrolled for next year, as long as the marketplace has enough information to do this and you don't fall in that category of somebody becoming eligible for Medicare. If the person wants to, I think the second half of the question was if they want to get financial help for next year, what do? They have to come back to the marketplace. They have to provide information about their household and their income if they want to be evaluated for APTC.
Thank you. Yes, that was a two-parter question. So on to the next. If a person is auto-enrolled without APTC, when do they need to cancel their plan by to avoid having to pay the January premium?
Okay, so this is good. This tells me people are listening. So they can log into their HealthCare.gov account, and there's a blue Stop Coverage for 2024 button that they can click. They can do that anytime up until December 31st. And if they do that, then they will not be on the hook for that January premium. Now, they won't have coverage unless they change to a different plan, then they wouldn't have, it is after December 15th, so that if they cancel their January coverage, then they're going to go bare in that month, but they still have a few more weeks of open enrollment left when they could choose a different plan that would take effect February 1st, assuming that no special enrollment period policies apply in that case. Now, if they're auto re-enrolled into a plan from a different insurance company than the plan that they had in 2023, maybe the insurers just canceled that plan, or they are not, or sorry, maybe that insurer has just left the marketplace altogether. Then if the person doesn't pay the first month's premium for that new insurance company by January 1st, then their enrollment won't be effectuated. This is we affectionately refer to it as the binder payment. And if they don't pay their binder payment, then they won't have coverage, but they also won't have a bill in the mail waiting for them to pay it for January coverage. So it's very complicated. You got to sort of piece it together, one piece of information at a time, and figure out the implications for every specific case.
Awesome, thanks. And actually, in regard to binder payments, we have a question asking, regarding grace periods, doesn't that apply only after the first binder payment?
That's correct. You have to make the binder payment in order to effectuate coverage, and then the grace period policies go into play, or come into play for the second and third months if coverage is not, if people are not paying their premiums. But if somebody misses, if they are automatically re-enrolled into a plan from the same issuer, then they won't have to pay a binder payment because they're already effectuated with that issuer. And if they fail to pay their January premium, then the grace period policy will take effect just like it would at any other month during somebody's coverage journey.
Okay, and one last question. And if we don't get to your question in this portion of the Q&A, we do have another Q&A at the end of the presentation. If someone reports a change and is found eligible for Medicaid instead of the marketplace, do they need to cancel their marketplace plan, or will the marketplace do that automatically?
That's a great question. So if somebody is found eligible for Medicaid, the marketplace doesn't necessarily know this. So the person should absolutely go to the marketplace and actively cancel their plan, or at this point they're enrolled in it, so terminate their marketplace plan if they're enrolled in Medicaid. Now, if they don't do this, eventually they will start to get notices from the marketplace letting them know that through periodic data matching, the marketplace has looked at data in the databases available to them and determined that they're eligible or actually enrolled in another form of coverage. And if the person doesn't get back in touch with the marketplace and explain that and say why, maybe they're not actually enrolled in Medicaid, but if they are, then they absolutely need to cancel it. Otherwise, the marketplace will cancel their coverage for them at that time. But they should actively do it. I just want to underscore that. They absolutely should actively cancel it if they know that they are enrolled in Medicaid.
Right. Thanks, Jenny. That's it for our first Q&A section.
Okay, great. So moving right along here, we've gone through what happens with redetermination, the first part of renewal, but now we want to talk about that re-enrollment process, how the marketplace selects a plan for somebody if they don't come back to the marketplace during open enrollment to actively shop. So first, I want to talk about a new policy for 2024. In order to maximize the number of people eligible for cost sharing reductions who actually receive them, HealthCare.gov is doing something different this year. And this is only true in HealthCare.gov states that I am aware of for 2024, but it is a new option that state-based marketplaces can also avail themselves of. So if you're in a state-based marketplace state, you should definitely check with your marketplace to see if this is something that they are also doing. But what HealthCare.gov will do is auto re-enroll people who would have been auto re-enrolled in a bronze plan into a silver plan with cost sharing reductions if there's a silver plan available from the same insurance company with the same network type and premiums that would be the same or less than that bronze plan that they would have been automatically re-enrolled into. Now, this is not going to affect every single person who has a bronze plan that could get CSRs if they were in a silver plan, because we need it to meet all these criteria so that it's as minimally disruptive to a consumer as possible, but it is going to help some people quite a lot. And if people don't like the plan they've been auto-enrolled into because of this, this new policy, just like any other auto re-enrollment, they can come back to the marketplace and make changes anytime before open enrollment ends. So just to show you a little bit about what this could look like, and these are based on 2023 plans, of course, we don't have the 2024 plans just yet. But on the left here, we've got a bronze plan, and on the right, we have a silver plan. These are both from the same issuer. They're both, look at this. They're both from the same issuer. They're both HMOs. And in this case, in this scenario, we've got a $348 tax credit. And so the person wouldn't be paying anything for premiums for either plan. But because of this new auto re-enrollment hierarchy, the person that had been in the bronze plan and paying $9,100 or having a $9,100 deductible, as well as out-of-pocket max, and having primary care visits and specialist visits only available after meeting that quite high deductible, they'll be moved to a silver plan where they have no deductible. They have a $1,700 out-of-pocket max, considerably lower, no charge for primary care visits from day one, and $10 specialist visits on day one. Now, this is just one needle in a haystack, one example of how this could work, but this policy could significantly benefit a lot of people, depending on, or it could significantly benefit a small number of people quite a lot, I'll put it that way. So now I'm going to walk through the rest of the the auto enrollment rules, but let's set that bronze to silver rule aside. Now that we've talked about it, we're going to assume that the cases we're talking about here, that this new auto re-enrollment bronze to silver thing does not apply. So the most straightforward thing would be to continue somebody's enrollment in the plan that they were in 2023. And in lots of cases, that's possible. And so that's exactly what the marketplace does. But of course, marketplaces are inherently dynamic and plans change a lot from year to year. And the exact same plan that someone had this year may not be available next year. So what do we do in that case? That marketplace has a hierarchy for determining what to do. If the same plan's not available, then first the marketplace will look to re-enroll them in a new plan offered by the same insurance company, and that's as similar as possible to their 2023 plan. This might not be possible though. The issuer may have exited the marketplace, for example, and in that case, the person will be auto re-enrolled in a new plan with a different insurance company that's as similar as possible to their 2023 plan. And this all happens with the auto re-enrollment process on December 16th. So what will this look like for people who are auto enrolled into the same plan? Well, they'll get notices from their insurance company that tell them their premiums, any benefits or cost sharing changes for the coming year, and an estimate of their premium with their new APTC taken into account. Now, it's just an estimate. This is not your eligibility determination notice that tells you exactly what your premium will be, but people are getting these notices right now, basically, from their insurers. The person can then choose to come back to the marketplace to change plans if they prefer. Their new plan would start on February 1st again if they take action after December 15th. But if someone is automatically re-enrolled and knows the plan is too expensive or not what they want, then they've got a little bit of time to change it. Now, what if the exact same plan that somebody had in 2023 isn't available next year? Well, then we know that the marketplace will look for a similar plan from the same issuer. And that means they're still going to get notices from their issuer with information about their financial help, benefits, cost sharing for the new plan, just like they would have been getting if they had been able to keep the same plan. But they'll also get information about the fact that they will qualify for a special enrollment period because their previous plan was discontinued. Now you might think, why do special enrollment periods matter if it's open enrollment? People can come and go anyway. That special enrollment period gives folks 60 days before or after the change to enroll in coverage, and it has faster coverage effective dates. So we'll talk about that again in just a second. But But finally, what if somebody's 2023 plan was offered by an insurer that left the marketplace altogether for 2024? Then they would be enrolled in a similar plan from a different insurance company. And people in this situation get a lot of notices. They get one from their 2023 issuer saying they're leaving the marketplace and their plan has been discontinued and they're eligible for a special enrollment period. They get a notice from HealthCare.gov saying that they're matching the person with a different plan. And then they also get a notice from that new plan. This is called the cross issuer notice that provides details about the plan and then how to pay the first month's premium. And remember, they will have to pay that binder payment to effectuate coverage in the new plan. Now, a little bit more about that special enrollment period. As I mentioned, people have 60 days before and after their December 31st discontinuation date to choose a new plan. So if the person uses the SEP before, then the effective date for their new plan is January 1st. That means they actually can come back after auto re-enrollment between December 16th and December 31st, choose a different plan, and that coverage will be effective right away on January 1st. They also have that additional 60 days after their old plan ends to make changes and then have a coverage effective date that's the first of the following month, no matter how late the person makes the change. So they could make the change on January 31st, and they could get coverage that starts February 1st, for example. So let's look at one more example here. This is Sam, and he's enrolled in a 2023 marketplace plan, but his issuer is no longer offering plans for 2024. So he gets all three of those notices from his 2023 plan, from HealthCare.gov, and from the issuer of the new plan that he's matched to. And he comes back to his account and sees all this stuff on December 20th. So he can see he's been auto redetermined for APTC of $315 a month for 2024. But he looks at that and thinks, you know, I actually think I'm going to make more money next year than I thought because I do have a new job. So I'm going to update my application right now. And it turns out he's eligible for less APTC. And he also looks at the new plan that he's matched with. This plan is going to show up at the top of his plan options during plan selection. So it's very easy to compare to other things. And he looks at the details. He says, the plan's fine. I'll go ahead and enroll in that one. But because he's a new customer of this issuer, he does have to pay the first month's premium by January 1st to effectuate coverage. If he misses this premium payment, the grace period does not apply like it would for missing a premium payment from a plan somebody's already enrolled in. Now, he has that 60-day SEP, special enrollment period, because of the loss of qualifying coverage when his previous plan was discontinued. So he could also choose a different plan until the end of February if he wants to for 2024. But unless he chooses a different plan or pays the first month's premium for the plan that he's matched with by December 31st, he could have a gap in coverage in January. His SEP lasts for 60 days after the loss of coverage, but the longer he waits, the longer his gap in coverage would be. Okay, so a little bit more about notices. You can see how easy it would be for people to get confused. They get a lot of information this time of year. After the marketplace open enrollment notice comes the eligibility determination notice. And this is, of course, what people get when they initially enroll in coverage as well, which tells them how much financial help they qualify for. But it also, in the renewal context, includes the plan name, the plan ID, and the income amount that was used to make the financial help determination, as well as action steps if anybody has, for example, data matching issues that they need to clear before in order to have their coverage. So you've got the link in the corner where you can look up more examples of these eligibility determination notices. There are lots of different varieties, but this is the notice that people will get once the auto re-enrollment process has happened. Now, if somebody's been automatically re-enrolled and they haven't, because they haven't returned to the marketplace, they're also going to get an enrollment confirmation message. This is different. And this tells them what happened with their situation, and then explains all of the action steps and what they can do if they don't like what they've been re-enrolled in. Now, HealthCare.gov gives people multiple ways to terminate their coverage if they don't want to be enrolled in the plan that they were auto re-enrolled in. But they have to do this again no later than December 31st in order to avoid being on the hook for their January premium. And just remember, if a household needs to terminate marketplace coverage for some of the people in the household, but not all of the people in the household, it is always best to call the call center. If you hit that end, I'll terminate all coverage red button, it looks severe for a reason. It will end coverage for everybody, and it will typically do so immediately. You definitely want to call the marketplace if you are looking for a future date to end coverage on, or you are ending coverage for some people in a household, but not everybody. So just to wrap it up for today, I hope it's even clearer why updating your information and actively shopping for 2024 coverage is essential. And it's also important to plant a seed with the folks who are enrolling for the first time now, so that they understand what will happen at the end of 2024 and the importance of updating their information and coming back to the marketplace next year. And remember, in addition to some of the new people who may come in the door to the marketplace just because it's open enrollment, we'll continue to have people coming into the marketplace from Medicaid because of Medicaid unwinding. And if they enrolled in the fall or the end of summer and they thought they were set because they enrolled in 2023 coverage, if they have a way to reach those people, it's important to remind them that they do have to be to update their information and renew for next year. And these are probably folks who have been through a lot with renewals recently, and so they may need help navigating yet another new and different renewal process. Third thing, remind people that they only have until January 15th or the end of open enrollment in your state to change plans unless they qualify for a special enrollment period. And then remind people to cancel their plan before January 1st if they don't want to re-enroll in it. So with that, we have a little bit of time now for Q&A. Ayasat, do we have questions?
Yes, we do. Our first question is just a clarification one. I thought consumers always have until January 31st to make the binder payment. Did that change?
That did not change. It depends on the issuer, and you want to be clear what their date is. Some states also have rules around this, but making the payment by January 1st, is the most fail-safe way to ensure that you will have coverage effectuated immediately.
Another question is, will everyone with a bronze plan who is eligible for CSRs be moved to a silver plan for 2024?
No. So this is only going to be people who would be auto re-enrolled in a bronze plan, but for whom that silver plan meets the key criteria. So it has to be from the same insurance company, it has to be the same plan type and network, and the premium has to be the same or lower than what they would have paid in 2024 for the bronze plan that they were being re-enrolled in. And people can change to a silver plan at any time during open enrollment. And the HealthCare.gov website will encourage people to consider, quote, extra savings plans. That's how they refer to the CSR plans, to take advantage of CSRs, but nothing will happen automatically for people that don't meet the key criteria for the automatic bronze to silver reassignment.
And I think you answered this in your recent response, but this question is, can a person change plans more than once during open enrollment?
Yes, they can. A person can even effectuate coverage and say, I'm going to start this plan in January, and then hit the brakes on January 10th and say, you know what, actually, I don't want this plan anymore. And they can change plans, and that new plan would be effective February 1st.
Awesome. Another question is, if a person is auto re-enrolled and then actively chooses a different plan between December 16 and 31st, when is their coverage effective?
So generally, people who are going to pick a plan after December 15th, their coverage won't be effective until February 1st, unless they qualify for a special enrollment period, for example, because their plan was 16th and the 31st of December, then that plan will be effective January 1st.
And another question we have is, what is the difference between canceling and terminating coverage?
That's a tricky one. We use those terms pretty interchangeably, but technically canceling coverage refers to ending a plan that you haven't yet effectuated. So if you've been auto-enrolled in a plan, you come back to your account after December 15th, you say, oh, I don't want this coverage for January, you would cancel that coverage. If you terminate coverage, that's coverage that you're already enrolled in, and that's basically what happens anytime after January 1st, whenever you've effectuated coverage. Once you're paying premiums, if you terminate coverage, you can do that at any time, but unless you qualify for a special enrollment period, if you terminate coverage throughout the year, then you are out of luck until the next open enrollment period.
And one last question is, if someone gets automatically re-enrolled, does the application include the information of the navigator that enrolled them the previous year?
Ooh, that's a good question. I do not think it does. I know that there has been an effort to include some navigator information on notices related to Medicaid to Marketplace transfers, people who are losing Medicaid and could now consider enrolling in Marketplace coverage, so that people could connect with an assister and get help with that process because of Medicaid unwinding. But I do not believe that Marketplace notices typically include navigator information on them in other circumstances.
Okay, thank you, Jenny, for answering those questions. And if we didn't get to your questions, we will try our best to get back to you through our Beyond the Basics email. And of course, if questions pop up after the webinar, you can email us at Beyond the Basics. So next slide. So here you can see, as a reminder, we will be distributing the materials from today's session via email. And again, we will post everything to the Beyond the Basics website. Our next webinar will be part 2, boosting enrollment among people who are immigrants and their families, outreach and application process considerations. It will be on Tuesday, October 17th at 2 p.m. Eastern Time. You can register for this and other upcoming webinars on the Beyond the Basics website under upcoming webinars. Here you can also find reference charts, guides, and other resources on the website. Next slide. And here are the resources for today's slides, and I will drop them in the chat again for everyone to have access to. Next slide. And here is the contact for Jenny, and again, the Beyond the Basics email for any questions or updates or comments that you may have. So our webinar is going to end a little early today. We're going to give 3 minutes back of your time. Thank you all for joining us. And with that, we will bring the webinar to a close.